I guess you're still awake. We are talking of health, so thank you, Sunita. I thank GOPIO, all the convener, Dr. Piyush Agarwal, the general convener, co-convener, Arvind Sood, Dr. Rajiv Mehta who is there in the back, Dr. Grace Sharma, and Dr. Thomas Abraham for giving me this opportunity to be part of this health panel. And like we said, or Dr. Ramvirar said, we need to talk about health for the Indian diaspora and make it a big thing for the next year. As a matter of fact, I think we have got aware and become aware of this because at the recent UN, India played a major role. Manmohan Singh was here talking about the non-communicable diseases. And I think we all Indians in this Indian diaspora need to take a big hand and make this happen for our communities at large. Having said that, I forgot to introduce myself. I'm Sunita Kanumuri. I am local here. I am an allergist. I've been in practice for the last 20 years. I live in Morristown area. I'm presently the president for American Association of Physicians of Indian Origin. I've been serving the community both locally, like I've been involved in the local communities, and also with our organization for the last 13 years. And I appreciate that you all gave me this opportunity to speak. Having said that, I think that AAPI and GOPIO share the same common goals, the well-being of the people of Indian origin and advocacy for our membership. While GOPIO has been pursuing this with representation of a wide range of issues, and of course I'm very proud that you have done this health commitment. For last year I was aware of it. I think I spoke to Sunita. AAPI focuses on representing the issues and concerns of the single largest number of foreign medical graduates. And we are about 30 years old. We have been fighting for the cause of our physicians for the last 30 years, and we have grown tremendously. We represent about 55,000 physicians, and it's my privilege really to be the president of this premier organization. And I look forward to working with GOPIO and other partners to empower the people of Indian origin. As a matter of fact, representing the physician organization, we are very strategically positioned to prescribe more effective healthcare solutions for the South Asians in general and greater health literacy among our members. And I welcome this opportunity to actually work with GOPIO, but also with Sati, and Dr. Sunita Gaur probably will give you a little bit more input on that when she comes up here, and talk about the South Asian Total Health Initiative, which is part of the Robert Wood Johnson. As a matter of fact, I think Sangeeta already covered, and so did Dr. Ramvirar, that we do have healthcare disparities, and we have health literacy challenges that we all face as physicians. Because we as physicians are well respected in this country, but we treat members of all civilizations, I would say Hispanics, African Americans, Caucasians, and Indians. So we, coming from a different country, need to be aware of the healthcare disparities. And so do the other physicians who treat us, because we see physicians of different backgrounds. So I think as many medical societies, state of New Jersey already promotes it. You can't get your license unless you pass the healthcare disparities and cultural competency exam. And I think that's very important. As a matter of fact, last night, I got a call from somebody from Idaho. She's a social worker, and this is not out in the West. She was doing a study, and she wanted to see how, as an Indian, what are the issues I face or think about when I came first, and how do I handle them with my patients today. So it is great that we live in New Jersey, we are in the East Coast, and we are prominent and address the cultural discrepancies and cultural competency and the healthcare disparities, but there are many, many states that are not doing that. And today, my role, I think, was to see, as physicians, what are we going to do for, or what are we doing or will do for members of our Indian diaspora. And this is something we are bringing from the physician level to all physicians, nurse practitioners. We are partnering with several pharmaceuticals. We look forward to partner with Sati because they focus solely on South Asians, and we as South Asians are very interested to do that and bring this to the community, to our physician communities. We're having CMEs and workshops to talk about cultural competencies and healthcare disparities. And we really encourage all physicians to take part in this. We are also starting to work on having webinars nationwide so we can make this awareness high. Probably the New Jersey physicians may not be interested, but nationwide they are. But it's always good to help them remember, or how do you say, revise again what you have forgotten. So having said that, I just wanted to bring to you a few things. Since Sunita already spoke on diabetes, in AAPI, what we have done this year is strategically placed ourselves to bring out to the communities and bring out healthcare literacies and education and prevention to our communities. This is part of our community outreach program. And when I took over on July 1st, I made that as a very strong initiative. I've spoken to Sunita. Many of the registered dietitians have also come forward and have worked with me. As you all know, that AAPI also has a nutrition book, and I'll let you know why I'm saying all this. As we all just spoke, non-communicable diseases. In the past, we talked about polio, hepatitis, and we're still talking on HIV. These are communicable diseases. But slowly and steadily, the non-communicable diseases have been creeping up on us, and it's become a great health problem. And the 4 common diseases are cardiovascular, stroke, respiratory, and cancer. And we all know globally it's an issue. I was just speaking to some of the high officials at WHO, and they felt that they're addressing the low economic countries like China, India, South Asia, but they forget that it's very high here, because here is a country of immigrants. So we have Hispanics, African Americans, and Indians who are in large number. So it's a huge issue. And we are, of course, interested in our own diaspora. It is about 35 million deaths per year. These diseases cause 35 million deaths per year, and 60% of these deaths happen globally, and 80% is, of course, on the low and the middle income countries. But good part of this is 80% of these diseases, especially the diabetes and cardiovascular, can be reversible, and 1/3 of cancer can be reversible. So we as physicians, we as communities, WHO and the states have the knowledge and the vision how to address these problems. I think we have the know-how, we have the ways, but what's missing is the commitment. Many people are coming forward as the awareness is increasing. So as a result, we are trying to partner with several organizations, both the medical societies, as I mentioned, look forward to working with Sati, GOPIO, and I'm also working with the temples, churches, so on, to bring this awareness. And what we did is we had a walk for fitness, focusing on fitness and nutrition. Because these communicable diseases, there are 4 trigger factors. It was unhealthy diets, inactivity or lack of exercise, and overuse of alcohol and overuse of tobacco. And we took 2 trigger factors especially because that is of great importance to us, that was diets and exercise. So to bring this awareness nationwide, we had done about 15 walk for fitnesses. And we did promote the AAPI nutrition book, where AAPI had collaborated with the registered dietitians to bring this out, that focuses on South Asian diets. I think it's one of a kind. There are not many books out there. And the 2nd edition is well done. Soon we are working on the 3rd. To bring out, as we understand more and more, it is the future, is integrative medicine, because there's a lot of knowledge out there how you can prevent or reverse diabetes. Yes, we have the genetic makeup. We as Indians, if you go, 40% of Indians have diabetes. Every other Indian that I meet, they have the gene, they're suffering, but then, culturally, we have so many festivals, and we do end up having sweets. Unless and until we serve the sweet, we cannot finish a festival. So we got to bring this knowledge, bring this awareness to our communities is very, very important. Even today I get calls about relatives, they have diabetes, but the diabetic care in India is not the best still, because the education and prevention is not the best. And that same thing lacks here, though, nowadays we have our parents, our grandparents living with us, but what's happened is it's not still, though we are there to educate them, I may be very cognizant but many of them are not. And they still have unhealthy diets when they have diabetes, and therefore suffer from neurological issues. Am I up?
Yes, you are up.
Okay, having said that, I just want to say we have a health initiative. We are working on Walk for Fitness. We are working on prevention. We are also doing CPR for citizens. Like, of course, we want to do prevention and education nationwide. And we also had our first CPR for citizens because we believe that hands-on CPR, 1 hour training, can prevent a life, death. So prevent a death. So coming to that, I look forward to partnering with GOPIO in bringing this to the membership and the communities and the Indian diaspora. And I think since I'm short of time, I would say, you know, alone we do go run fast, but together we run fast. And it's together we can be one voice in making this happen and bring, and unless and until, like Gandhiji said, you know, you have to be the change you want to see in this world. So let's all work together and join hands. Thank you.
Thank you so much.
Thank you. You're going to stay for a bit, right?
I have a flight, so.